So you have pain in the back of your leg and you're calling it sciatica. And I'm here to tell you, not necessarily. Stay tuned. Hey, this is Dr. Shakib from Irvine Spine and Wellness Center, your Irvine Chiropractic Posture and Movement Clinic. Just because you have pain going down your leg in the back does not make it a sciatica problem. Sciatic neuritis is an actual inflammation and irritation of the sciatic nerve. So unless you have pain that goes from the back and goes straight down to your leg, you don't have sciatica. But you do have that pain in the back of your leg. So what is that? They've actually, as of 2022, they actually moved that diagnosis of piriformis syndrome from an issue related to the muscle piriformis. They changed it into sciatic neuritis, which personally I'm totally against, because we need to be very careful how we identify problems and how we are treating the problem. So piriformis syndrome can actually have pain in the back of your leg, but not as a result of irritation of the sciatic nerve. So what does that feel like? You have this pain that starts in the back of your pelvis and it goes down your glute a little bit, but then it goes kind of laterally. If it skips, it's more than likely trigger points in the muscle. So it's not a nerve issue, it's a muscle issue. So do you isolate the area and stretch it? Do you massage it? What is it that you do? And the answer is all of that and more. So what you should not really, I don't recommend you do, is to put a ball over the area. That's too big of a zone. Too big of a ball. So if you're thinking I'll get a smaller ball, but then that's a lot of pressure. So you don't want to insult a muscle. You want to approach it gently and carefully. When you go with so much force right away, you get a muscle guarding and it defeats the purpose. So what you want to do is, I'm going to show you the piriformis stretching, and the way I like doing it is actually laying down on the floor. So I'm going to get my glutes and my pelvis as close to the wall as possible. So I'm like that, and I'm gonna have one knee over the other knee, not foot, but knee over the other knee, and try to bring my foot down so it pushes both of my knees towards my head, and it actually, I'm feeling my piriformis stretching. If I want to get more stretching, I'm just going to come closer to the wall, knee over knee, bring the foot down and rest my pelvis and my whole spine down, and I get more and more stretching. If you start having issues in the front, in the groin area, step back, don't get overexcited about stretching it, work your way up. If you have issues in the front of your thigh, you have hip mobility issues, it's worth looking into. So that's the piriformis stretching. Should you stop with that? I'm not a big fan of isolating a muscle to stretch it, but that kind of gives you a relief until you go to the right office to get your stability, movement, and balancing worked on. And that's something that is not looked at. We live in a society where we isolate a problem and we only work on that isolated problem when it comes to movement and stability. It's not the body part in isolation, but how well it plays with the rest of the body that needs to be looked at for a long-term solution. If you have any questions, make sure you contact me. If you'd like to make an appointment because you feel like this problem is not solved and I need to get to the root of the problem, give me a call and we'll take a look. Thanks for watching. Take care.